We really had some fun success over the last 6 months with something that's been going on for 30 plus years. Good morning, everybody. This is Dr. Warren Kalkstein here with Robert, a veteran that comes to see us in our office. I wanted to share a little bit about the program with Community Care. Before we get started, thank you for your service in Vietnam. 1 year, 10 hours, and 5 to 8 minutes. Happy to see you in the rearview mirror when you left, I'm sure.
Yes, oh yeah.
Robert and I go way back in terms of working with each other. He periodically through the year gets referrals over from his primary care at the VA, and he goes through a program called Community Care. Our office is a part of that program where when he comes over, I have access, or I'm able to give and provide care for Robert, including shockwave therapy, physical therapy, massage therapy, chiropractic care, soft tissue work, etc. So it's a really amazing program, and we've got a great relationship with the VA in that. And you can probably speak to that. I mean, Robert, in the process, he does research for a living and writes books about all kinds of events, especially field hockey. But in the process of going through and getting referrals over here, you've educated me along the way of what they look for, how to help other veterans in the community. So I'll let him speak to that. I'm going to work on him a little bit while we catch up. But if you are a past patient, or if you haven't heard of us before, and if you would like to receive services from our office through the VA, you can go through your primary care. It's a process, but it really does allow you and give you access to a great team here in Towson. Okay, I think I kind of covered the bases on that one a little bit. Anything else you'd kind of add to that relative to your experience or what you would recommend?
Well, it's a changing playing field. It used to be you simply would request through your primary care that you wanted some special services. The primary care would make a console and request that you get those special services. Unfortunately, during the years just before the pandemic, there was a lot of abuse of the system, and the system went through a complete change in the years 2019, 20, and 21. Now you still make a request through your primary care physician, but the request goes through a series of approvals, as many as 3 or 4. It used to be that you could get up to 10 to 12 appointments. Now it's pretty much 8 appointments. I would suggest that if you get approved through Community Care, that will provide for you some really special things that Warren does and the rest of the team do here, that, let me tell you, that extra service that you can get makes a difference. I can feel it. But when you go to schedule your appointments, use some thought behind it. Don't try to schedule and bunch everything together in 1 or 2 month period of time, because that's not going to get you the results that you want. Plus, Community Care is going to be watching how you use your appointments.
Yeah.
Schedule your appointments over a 6 or an 8 month period of time, because that's the time period that Community Care is going to give you. Use the process. Accept the protocols. They will have an impact, and if you do it in that manner, the next time you apply at Community Care, they're going to be more apt to approve you in maybe 1 or 2 approval process steps than 4 or 5.
So there's a couple of things that we've worked on with Robert, right? He's had injury in the war that's sustained over time in terms of an IED explosion and things of that nature that have caused some chronic lower back, discogenic, arthritic type pain that refers down his leg. So I treat him for those issues. Recently he came in with a different referral relative to a rib aggravation. So he ruled out cardiovascular issues, went to pain management. They kind of agreed with the treatment plan that we were doing, and we've been doing soft tissue work and adjustments around his mid-back where he had that irritation. So what do we help with? Musculoskeletal issues of kind of a lot of different nature, whether it's plantar fasciitis or whether it's a disc irritation or a pinched nerve in the back, right? And then I know there was a lot of information relative to the administrative side of things, but we'll help guide you through that. You don't have to remember all that, but that's just a really good understanding that he has. Is people abuse the system in the past, so it's privy of you not to do that going forward. And we don't schedule people out that way. We don't want to use all your visits up unless it's clinically necessary, and we require to get you in here a little bit sooner. Then we'll definitely do what's best by you first. Okay, so. As it relates to what we can help with, those are some of those things. How you go about the process, I hope you understand that. And some of the services and the therapies that we offer here, I hope you have a general understanding. So if you or you got somebody in your life that hasn't really followed through on something, or something has been sustained over a period of time, I see those type of problems all the time. And I think that we can really provide some breakthrough pain relief with some of the additional services that we're able to create and provide for you, and just this awesome team here. So I would love to help you out. I really appreciate the people that we get to work with. We have a great group of patients in here, but it's really special when we get to work with veterans. Our family, a lot of people in my family have served, so it's my way of kind of keeping attached, if you will, or supporting that community, and grateful to be able to do that. I've had past experiences in a setting with working with active duty at Walter Reed, where I did my preceptorship. So I have a general understanding of kind of the workups that people go through the VA system, through the military hospital system, and I just would like to continue to do so in private practice here in Towson. So, like I said, I happily invite you to come in. Grateful to get to work with you. All right. So I'm going to do some soft tissue work, some pin and stretch, some massage on his shoulders and his neck. I'm going to adjust his neck, but I wanted to share that with you. And we've already kind of worked on his mid-back, his lower back. He's just getting adjusted today, but when he gets that referral over from the VA, we'll be doing more therapies and services, and maybe we can share some of those potentially when you come in the next time, if that's okay with you.
No, that would be fine, because I'm walking proof that it works.
Yeah, we really had some fun success over the last 6 months with something that's been going on for 30 plus years. Yeah. So it's not, I would say don't give up. I'm pretty competitive on dealing with problems like this. So, and grateful to get to work with you, Robert. Okay. Genuinely, thank you, and I appreciate your service, everyone that's watching. Awesome. Cool.